38 Natural ways to lower blood sugar after 60 blood sugar. For most of their lives, many people barely think about it. Then a routine blood test comes back with prediabetes or elevated fasting glucose, and suddenly it becomes impossible to ignore, and with good reason. Chronically elevated blood sugar is not a minor inconvenience. It damages blood vessels throughout the body, the eyes, kidneys, nerves, and heart. It doubles the risk of dementia. It increases inflammation, accelerates aging, and drives the progression from prediabetes to type 2 diabetes, which affects over 30% of adults over 65. But here's what is truly encouraging. Blood sugar is one of the most responsive metabolic parameters to lifestyle. The right changes to diet, movement, sleep, and stress can lower fasting glucose, reduce insulin resistance, and in many cases reverse prediabetes entirely, naturally, without medication. Today we're covering the most evidence-based natural strategies. Blood sugar is regulated by insulin, a hormone produced by the pancreas that signals cells to absorb glucose from the bloodstream. In insulin resistance, the underlying mechanism of prediabetes and type 2 diabetes, cells become less responsive to that signal. The pancreas compensates by producing more insulin. Fasting blood sugar begins to rise. Over time, if insulin resistance is not addressed, the pancreas cannot keep up and blood sugar becomes chronically elevated. Insulin resistance develops through multiple mechanisms: excess abdominal fat, which releases inflammatory signals that impair insulin signaling. Physical inactivity, muscle is the primary glucose disposal site. Inactive muscle becomes resistant. Chronic poor diet, particularly excess refined carbohydrates and fructose. Chronic sleep deprivation, chronic stress, and aging itself. All of these drivers are addressable. Addressing them produces real, measurable improvements in fasting glucose, postprandial blood sugar spikes, and hemoglobin A1C, the 3-month average blood sugar marker. Diet is the most powerful single lever for blood sugar management. Reduce rapidly digestible carbohydrates. Refined carbohydrates, white bread, white rice, sugary drinks, baked goods, breakfast cereals, are digested rapidly and cause sharp postprandial blood sugar spikes. Replacing these with whole food carbohydrates, legumes, vegetables, whole grains, berries slows digestion and produces a much gentler blood sugar response. The glycemic index and glycemic load provide useful frameworks for food selection. Low glycemic foods, legumes, non-starchy vegetables, most fruits, nuts, full-fat dairy, consistently produce better blood sugar responses than high glycemic alternatives. Fiber is one of the most powerful dietary blood sugar regulators. Soluble fiber, from oats, legumes, psyllium, vegetables, forms a gel in the digestive tract that slows glucose absorption. Aim for 25 to 35 grams of total fiber daily. Food order matters. Eating vegetables and protein before carbohydrates at a meal reduces the postprandial glucose peak by up to 30%. A simple, free intervention with strong evidence. Vinegar. A tablespoon of apple cider vinegar in water before or with a meal has been shown in multiple clinical trials to reduce postprandial blood sugar spikes. The acetic acid inhibits starch digestion enzymes. Protein at every meal slows gastric emptying and stimulates insulin-independent glucose uptake in muscles. Exercise is the single most direct method of lowering blood sugar in the short and long term. Acute effect. During exercise, working muscles absorb glucose without requiring insulin, an insulin-independent uptake pathway through GLUT4 transporters. Blood sugar drops during and after exercise. A 20-minute brisk walk after a meal can reduce the postprandial glucose spike by 30 to 50%. Long-term effect. Regular exercise increases insulin sensitivity, the fundamental goal of blood sugar management. Muscles that are trained regularly maintain a greater capacity for glucose uptake, keeping fasting blood sugar lower between meals and reducing the A1C. Resistance training has particularly potent effects on insulin sensitivity because muscle mass is the primary glucose reservoir. Building and maintaining muscle through resistance training, even twice a week, has significant blood sugar benefits that extend for 24 to 48 hours after each session. The most practical recommendation: walk for 10 to 15 minutes after your main meals. This is both highly effective and very accessible. Two often overlooked drivers of elevated blood sugar are sleep deprivation and chronic stress. Sleep deprivation reduces insulin sensitivity profoundly. A single night of poor sleep can reduce insulin sensitivity by 25%. Chronic sleep deprivation maintains chronically elevated cortisol and growth hormone, both of which raise blood sugar and drive glucose production by the liver. Getting 7 to 9 hours of sleep and addressing sleep disorders like sleep apnea, which severely impairs blood sugar control, is a genuine blood sugar management strategy. Stress raises cortisol, which directly stimulates gluconeogenesis, the liver producing glucose, and reduces insulin sensitivity. Chronic psychological stress produces a sustained cortisol elevation that keeps blood sugar higher than it would otherwise be. Stress management techniques, deep breathing, mindfulness, exercise, social connection, are therefore metabolic interventions as well as psychological ones. Several nutrients and supplements have reasonable evidence for blood sugar support, though none replace lifestyle changes. Magnesium is required for insulin signaling and glucose metabolism. Deficiency, present in the majority of older adults, is associated with insulin resistance. Magnesium-rich foods, dark leafy greens, nuts, seeds, dark chocolate. Supplemental magnesium glycinate at 200 to 400 milligrams daily is well tolerated. Cinnamon has shown modest blood sugar-lowering effects in several clinical trials, likely through mechanisms that enhance insulin receptor sensitivity. Half a teaspoon daily in food or drinks is a low-risk, reasonable addition. Berberine, an alkaloid found in several plants, has multiple clinical trials showing blood sugar reduction comparable to some pharmaceutical agents. It should be discussed with a doctor before use, as it does have drug interactions and is not appropriate for everyone. Chromium is involved in insulin signaling. Some evidence supports supplementation in deficiency states. Blood sugar is one of the most responsive markers in the body to lifestyle change. Prediabetes is not a life sentence. It is a warning with time to act. The tools are straightforward. Reduce refined carbohydrates, increase fiber, move after meals, build muscle, sleep well, manage stress. Combine several of these and the results are often dramatic. If you have diabetes or prediabetes, work with your doctor, monitor your numbers. And know that your daily choices are making a real, measurable difference every single day. See you in the next video.